Hi there. We are a group of undergraduates of the CSE department of the University of Moratuwa. We developed an application to track the COVID patients and hospital capacities, which will enable the authorities to access patients' details and as well as current statuses of the hospitals. The primary user of the mobile application is the patient. Anyone can view the public dashboard without login into the system. Using the dashboard, the public can view the fluctuation of the number of active cases over time, the number of total active cases, death recovered. This will enable the public to aware of the current pandemic situation in the country. Registered patients can log into the system using their credentials. If they forgot the password, they have the option to reset it too. Once patients log into the system, they are able to view their previous medical histories. In medical history, they will able to see when they get admitted, when get discharged, what symptoms they had. They can see their previous PCR test results also using mobile applications. As well as they have the option to update/change their information too.
Just after we enter into system, we can see the public dashboard. It can be seen by the public. There is no any requirement of being a user of the system to see the public dashboard. Anyone can see the public dashboard and get to know about the current pandemic status of our country. At first, let's log in as Health Ministry admin. After login, Health Ministry admin can able to see his dashboard. In the dashboard, he can be able to see the statistics of the current pandemic status of our country. Admin has the ability to change his password. To change his password, he has to give the current password first and the new password he wanted to be changed. Admin can also be able to view the hospital details already present in our system. He can also be able to add new hospital to the system. In order to add new hospital, he has to fill this form and submit. The newly added hospital is in the last row of the table. Also, the Health Ministry admin can also be able to add hospital admin for each hospital. For example, in order to add hospital admin for the hospital, the admin needs to fill up this form and submit. These are the main functionalities of Health Ministry admin. Now let's log out and move to the next role. Now let's log in as hospital admin. After the login, hospital admin can be able to see the current pandemic status in their hospital. Hospital admin can view the patient details of the hospital. All patients mean all the patients who are registered in our system, and active means the patient who are currently getting treatment in the system. The hospital admin can also view the profile of the patients, which can give further details like the ward number and the medical history of the patient. Also, admin can search the patient based on using the NIC number, and admin can admit new patient to the system. Before admit new patient, admin has to check whether the patient is already present in our system. So by enter the NIC number, search for the patient. If the patient is already registered in a system, it will give a message like this. Then the admin can't register the patient again. So during the admission process, admin has to select the ward number and admit the patient. Update details button will render a form in which hospital admin can update details about the symptom. Also, he will be able to add the drug details. Next case is when searching for a patient, if he or she is not presented in the system, there will be a message like this: not found, please register patient. Then hospital admin can register the patient to the system. To register the patient, he has to fill up this form and add patient. Hospital admin can also add PCR results by filling up this form, and PCR results of patient can be positive or negative. Hospital admin can also check and approve the PCR results of the patients. After the approval of the PCR results, he has to confirm, and then the details will get added to the profile of the patient. He can also search PCR results of a patient using patient's NIC number. Hospital admin can also view wards of the hospital. He can add new wards. He can update wards. Hospital admin can also add new hospital staffs to the system by filling up this form. These are the main functionalities of hospital admin. Now let's log out.
Now let's log in as a patient. Once after login, patient can see his profile. Also, patient can edit his profile details. These are the functionalities of the patient user role. That's all for the web application.